And what are you here for today?
You're so jolly. Just an office visit, regular office visit. This is my third.
Your what?
My third office visit.
17 weeks?
Yes, 17 weeks and 3 days.
Do you have any particular questions or concerns?
I was here, I was here Monday because last Saturday I had some spotting and bleeding, and it went through, I think, like till Wednesday.
Okay.
Like spotting.
Was it bright red at first?
Yes.
And did it trail off to be
Dark
brownish?
Yeah.
Okay.
Yeah, it got darker.
And was that connected? Had you had intercourse?
We did.
You did?
Yeah,
Okay.
On Saturday.
That's the most likely culprit usually.
Yeah.
And she was going to make me ask you because is there any risk whatsoever of us
Like
risking the baby for having
With
sex?
having sex?
Yeah, I mean.
So having sex will not interrupt or harm a healthy pregnancy. It will, however, sometimes make you bleed, and that's because there's lots of extra blood flow to the mucous membranes. So that shows up in different ways. You can have bleeding, just the mechanical, with penetration, the cervix gets disturbed, so there's lots of blood flow in that area. It's the same process of a lot of pregnant women have nosebleeds or have their gums bleed when they floss or brush. It's the same thing happening, so it will not hurt a pregnancy unless we know that you have some other high risk situation. Like the most common would be either preterm labor and a preterm short cervix. We'll look at that on your 20-week ultrasound. Or placenta previa. That's when the placenta forms over the cervix. I was really surprised. I've been a midwife for about 10 years. I just had a son about a year and a half old.
Congratulations.
And thank you. Thanks. I learned lots of things in that process, one of which is that pregnancy is uncomfortable, and there are so many cramps and tugs and pulls and shooting pains that I think if I hadn't been a midwife, I would have been calling every week. Like, what am I feeling? But because I know that those things happen, but I was just really surprised at how uncomfortable it was and how many of those types of things happen. In the third trimester, it's good to not be flat on your back because that can put pressure on the big veins that go back to the heart. Up until 24-ish weeks, if you want to be on your back, that's fine. And it's even better if you have a little bit of a tilt like that under your head or tilt on one side of your body.
That's good.
Just so you don't have...
Can I put like a pillow on my butt?
Yeah, like behind here.
She's got a million pillows.
Does she? Yes. Yeah. And what day did they transfer, a 3 or a 5 day?
5 day.
5 day. And so we're using 21st is what they assigned. I'll go back and check those records and we'll just keep it there for now. So we have a graph here. This is the bottom line would be 25 pounds, top line would be 35 pounds. So you're right in there. It's perfect.
Okay.
Yeah.
I'm in between.
Yeah, you're right in between the lines.
Okay.
So we can show you that graph each time, just if it's helpful for you to have a visual. Okay. Have a seat up here. Let's take just a few minutes to find, so I don't want you to feel worried. I find it louder than that.
Sounds like a predator.
Baby might be, that's the heartbeat. 154. Perfect. There we go.
It's loudest.
Yep. We often find it down here. You can actually hear that's the heart valves opening and closing to pump blood through the heart. 150. Sounds perfect.
Good.
Yeah, some good beats.
Yeah, so the baby will grow up about 1 centimeter per week. Let me just do a measurement here just so I can get an idea.
Can you tell how big the baby is right now?
You actually are at your belly button. You'll start poking out more. People kind of carry differently.
It's roughly the size of like an avocado right now, right?
I have a short torso too.
That makes you show more. avocado.
I think it's like an onion or turnip right now. 5 inches.
Yeah.
Yeah.
Let me think. 17. And the baby by 20 weeks will be just under a pound, usually 13, 14 ounces, pound 16 ounces. Yeah. Okay.
So everything is good. Oh, thank you.
Everything's great. Great heartbeat, good size. The centimeter measurement on your belly was between 17 and 18. People don't really take seriously enough is unwashed fruits and vegetables. So you have to be really careful.
Oh, I was eating that veggie plate a while ago.
Well, I think it's washed before. It was
careful. Like sprouts is a big one. Like raw sprouts on a sandwich that can be in there. Cantaloupe or like fruit that has like a bubbly outside. Even like an avocado, wash the avocado before you cut through it because the bacteria goes through.
I haven't had an avocado.
Yeah, I'm the avocado guy.
But I eat like oranges straight from. I don't wash them.
So
just wash everything from now on.
Wash it.
I'll go through the refrigerator and wash everything we have.
Yeah, you know what I really like? Trader Joe's has like a fruit and vegetable wash. It's almost like a soap. It's like a flavorless soap, and the oils and the bacteria stuff cling to it. So I like that.
Oh, well, better get one. I eat bananas. I don't have to wash bananas.
No, you don't have to wash bananas because you don't touch those.